Good afternoon, Berkeley, and thank you for joining us for this virtual town hall with Berkeley City Manager D. Williams-Ridley, City of Berkeley Health Officer Dr. Lisa Hernandez, and our Berkeley Planning Director Timothy Burroughs around Berkeley's response to the COVID-19 pandemic. And I want to take this opportunity to thank all of our city leaders for joining us today and for joining us over the past several weeks. I know our community has really appreciated the opportunity to connect with key decision makers around our response to COVID-19 and to get important information about how the city is addressing this health emergency and to be able to answer your questions. And we received a lot of questions today. And I know last week we received questions on Facebook, as this is being actually streamed on multiple platforms, Twitter, Facebook, and YouTube. And so we will try our best to respond to all the questions that we've received this week. But if we're not able to get to the question, we will be sure to get to it next week. And we've been doing these town hall meetings on Saturday at noon. And I really appreciate our city manager and health officer and planning director for making themselves available for this opportunity to address the Berkeley community. Even though we cannot see you physically, we want to stay connected to you. In the theme of what's next, which is a theme last week's town hall was focused on, this town hall will be focused on the recent shelter-in-place order that was extended this week by our City of Berkeley health officer and health officers throughout the region until the end of May. And that new order does ease some restrictions on certain business activity, which we'll talk about, including around construction. And so I'm very appreciative that our planning director joined us to be able to talk about how the planning department is going to be implementing this new order, particularly addressing the many construction projects that will be requesting inspections and permits. But I just want to start by saying how appreciative I am to the Berkeley community for how seriously we're taking this emergency. We have seen states that have lifted restrictions. We've seen people protesting in front of the state capitol saying, lift these restrictions. We know it's difficult, not just for our residents, but also for our local businesses and nonprofits. And we are doing what we can to help support our business community and our arts community and our nonprofit community and residential tenants during this time. But these regulations are essential to help reduce the spread and to keep our community safe. And your decision to stay home and save lives, the fact that I see so many people that are abiding by the mask rule to wear facial coverings when you're outside, the fact that people are practicing physical distancing is really working to reduce the number of cases in our community and to help address this public health threat and to make sure that we can reopen in the future and reopen in a way that's safe and reopen in a way that will not be disruptive to our business community and our nonprofit community by having to close again if there's another wave of infections. So today we're going to focus on the shelter-in-place order. Our health officer is going to provide an update on the number of cases in Berkeley and share some information around the recent order. Our city manager is going to provide an update around operations, and our planning director is going to update us on how the planning department is working to implement this order. So with that, I'd like to now turn it over to our City of Berkeley health officer, Dr. Lisa Hernandez, and thank you for joining us, Dr. Hernandez. And if you can update the Berkeley community on the number of cases in Berkeley, the recent order, and anything else you'd like to share.
Great, I will. Good afternoon, and it's always a pleasure to be here. We'll start with the cases specifically in Alameda County. Actually, I'll start with the U.S. and then go down from there to the state, to the county, and the city. In terms of confirmed cases for the United States, there's over 1 million cases now of COVID-19 that have been confirmed. In terms of deaths, there are 64,283 deaths in the totally in the United States. For California, the cases count 52,197, and the deaths are over 2,000 right now at 2,171. For Alameda County, the number of cases are over 1,500, so 1,582 cases with 61 deaths. In City of Berkeley, we have 53 cases and 1 death. In terms of tested, so we're looking at the, and this is posted on Alameda County's web site as well, and we have these numbers as well on our web page, and I'll talk a little bit about that in a second. The city of Berkeley cases, number of tested are 1,152. Those are the number of individuals that are city of Berkeley residents that have received tests. And the percent positive of those tests is about 4.6%. We now have a data dashboard, so yay. It's up there as of yesterday, and the dashboard is updated every day, 7 days a week, which I think might be a little different in some of the other jurisdictions, but I just know about ours, where you can see our data. If you go to the COVID web page, and you'll see the little icon that shows our dashboard. You click there and you can see the dashboard, and it's interactive. There are data that we cannot show because of privacy issues and the size of our city. Some of the numbers are what we call unstable, so it may look like it's a big jump in a specific data point when it really isn't, because it's just a change of one or two. But because of our denominator, the size of our population, it looks like the change is bigger. So with those data, we do point to Alameda County. Our data is fed into Alameda County's data. So we are looking at those numbers specifically for hospitalizations and some of the demographic data. When we can release it, we will. We know that ourselves included, we want to share that data, but we want it to be meaningful, so that when you look at the information, you understand what it means. And if you see large jumps in some of the graphics, it's not necessarily a large impact on our jurisdiction. I want to talk a little bit about what we're doing in skilled nursing facilities. We continue to support the facilities. We have a task force that works with the facilities in our city. We're actually piloting a testing, it's called surveillance testing, that we're doing in some of our skilled nursing facilities next week, where we're testing everyone in the facility, whether they have symptoms or they don't have symptoms, residents as well as staff. And that is a collaboration with not only the public health division, but also with the healthcare providers that attend to the residents in those facilities. And that's because we know that up to or over 50% of those that are tested positive in a skilled nursing facility are asymptomatic. So we want to kind of interrupt the spread of transmission as soon as possible in those facilities where we know there could be devastating impact. Talking about testing, starting Monday, we are testing, have all symptomatic residents or people who work in Berkeley who are symptomatic can get testing at our Berkeley test site. There is a bilingual triage line that is staffed from 9 to 4 p.m. And people can need to have an appointment, so they need to call that line. And the number, I'll give it to you, but there's going to be more information on our webpage on starting Monday. The number is 510-981-53. Oh gosh, I'll repeat and find the number. I actually didn't put all the numbers on there. So if I can't get it before the end of the presentation, I will definitely, please look at the webpage. In terms of contact tracing, a lot of people have actually generously volunteered or asked to volunteer to do contact tracing with us in public health. We love those offers. Please go to the webpage where there is a link where you can volunteer. It says take action. It's the tab. If you go there, you can sign up to be a volunteer, and we'll pull from those applications to get staff. Contact tracing is something we do all the time for any disease. It's just, this is a little different because of the the volume of cases that we have for a specific disease, but we do this for each disease, where we interview someone who has the disease, find out their exposures, who they were in contact with, and then locate their contacts. But just want to know, this is a little different because of the volume. We're also working with the state, who's also providing some support on capacity and some of the tools that we will need. So I'll go into the order a little bit now, which, as the mayor mentioned, it goes into effect tomorrow, the 3rd at 11:59 p.m. And it's in effect until the 31st at 11:59, unless it's amended or superseded or rescinded. And I want to make a point about that, because we are looking at uh, the impact of this order day by day. The health officers, with the order and the frequently asked questions document, there's also an indicator document that I'll talk a little bit about, which shows what we're looking to see, what the impact of the order is, and how the change in activity has impacted, good or for bad, on the community's health and the number of cases. So if things look good, we're hoping to open up more, because we know that this has been an impact on our community, and I'm really thankful for how compliant everyone has been. It's hard, I know. So I just wanted to point that out, that we are looking at the impact all the time. And we wanted to have those indicators there. So the main changes, as the mayor mentioned, one will be in terms of construction. All construction is being allowed, and Timothy Burroughs is here to speak more on that. And I'm thankful for planning and their support and work on that. There's some changes on real estate transactions, childcare establishments, being able to have support for childcare for those that are able to go back to work. So that's the change, is that it's expanded to beyond just essential workers. It's to those workers that are now working with this new order. And outdoor businesses was the other change, such as nurseries, landscapers, and agricultural types of businesses. And then outdoor facilities, the use of those facilities, including parks, if they're allowed. And I know one specific here is skate park, and we've been working with the Department of Parks and Recreation and Waterfront on those issues. So I'll stop now, because I know there's going to be more questions on that, but I want to just wrap up.
Okay, thank you very much, Dr. Hernandez. Before I go to the city manager, I just want to let everyone know that this week we started the fiscal year 2021 budget process, and our Budget and Finance Committee received a presentation from our city manager on the projections of revenues and expenditures for next year, including the projected decrease in revenues due to the impacts of COVID-19. The city is estimating a $25.5 million deficit next fiscal year. And it's going to be challenging for a city to close that gap. And that gap may be larger depending on the duration of business closures and the loss of tax revenues. And so we are beginning the process, working in partnership with our city manager and city administration, to begin to look at the economic impact of COVID-19, and also to look at how to balance our budget to prioritize health and safety and essential services. So, Madam City Manager, if you can touch on an update on operations, crime statistics. I know we've gotten a lot of questions around crime. Anything you'd like to share around the budget, and anything else you'd like to share with the Berkeley community.
Thank you. Thank you, Mr. Mayor. And I just want to really thank you again for holding these sessions with our community, and to thank Timothy Burroughs and Dr. Hernandez for joining us today. I do want to focus on three major topics, and I'll try and incorporate some of the other questions that you've asked. So number one, operations. We are continuing to uplift and bring in employees as disaster service workers to address the new shelter in place. We're looking at mobilizing monitors to support our planning department, so that the community is not tasked with making sure that our business community is compliant with the shelter in place. So we are going to be serving our community as well with some of our disaster service workers. Also, we've had a couple of setbacks around our unhoused community in terms of lifting up the La Quinta Hotel. As you know, negotiations fell through on that project, but we are going to continue moving forward and looking for other alternatives. We had lined up over 45 plus unhoused members of our community to move into those hotels. They were tested, transportation was available. We had worked out all of the plans. So we're pretty devastated about not having a local room key safe place for our unhoused community to go. But we still have other opportunities. We still have over 18 RVs that we're moving people into. We have a 4-bedroom home. We have our shelters that have been thinned out completely so that we're able to now mobilize some of the other shelter spaces and allow folks to come into there. So we're continuing. We're still out there every day working with our unhoused community, looking at issues around food insecurities, face coverings, also providing them with mental health and public health support services. So we're out there moving the needle with our unhoused community. Also, one of the things that people are concerned about, and rightfully so, there's just been a huge amount of folks on our sidewalks and on our streets. So I've mobilized our neighborhood services team, our police department and public works to go out and just to help relieve some of the debris and garbage that are on our streets. Our unhoused are asked to shelter in place as well. So I want our community to know that you are going to see a number of tents and camps out there in our community, but we're going to try and keep it clean and keep them safe. So that's our goal right now. We're trying to enforce things like making sure there's ADA access on the sidewalks, but that's not displacing folks at this time. People will need to be safe and remain in their sheltered spaces, and some of those are tents. The last thing I want to say is just a big thank you to our EOC staff, led by Paul Budenhagen, our Deputy City Manager, and our internal staff that you don't get to hear a lot about that are also pushing forth major efforts and making sure that the Berkeley Relief Fund and all of the grant funds that the mayor and the council graciously put forward, and making sure that our tenant opportunities are successful with helping folks to pay rent. And so we have people that are mobilized in an EOC, but we also have people that are mobilized in their homes, working from home, and we're going to keep pushing that needle as well. In terms of our budget, we did have an opportunity to present to the Finance and Budget Committee. We do have some tough decisions to make ahead of us. We believe that our departments and our staff and our council will be able to look at some of the things that we can do to reduce that the hit to our revenues. One of the things that I, and along with the department budget manager, we've requested of departments to start looking at 10, 12, and 15% reductions. Now we're looking at things that won't necessarily impact. We're not trying to look at a service reduction. We're not trying to look at a workforce reduction. We're looking at those things that we can defer. We are looking at a deferral first approach because we know that this could be a short-term, this could be both a short-term and a long-term issue facing us. So our first goal is to look at things from the short term and project a long term at the same time so that we are prepared to move in a very methodical way in terms of addressing our budget needs. We will be having regular meetings with the Finance and Budget Committee, and we will also have a series of meetings with the council. So I invite our community to make sure that they tune in to those meetings so that they can hear and understand some of the challenges we're faced with and how our decision making is going to move forward. And then the last thing I think I probably want to touch on is the fact that we are truly, I know you see a lot of commercials out there about it. We're all in this together. No, we are all in this together. We are absolutely in this together. And so as often as you can tune into council meetings, into budget and finance committee meetings, I think those are very important things for you to get involved and to listen and be a part of. So Mayor, thank you. I hope I covered most of what you asked. I can also go over some crime stats if you'd like to come back to me or if you'd like for me to proceed now.
If you could touch a little bit on crime statistics, I know we've gotten some questions around that. That'd be
Yes,
greatly appreciated.
thank you. So right now there's some kind of crime. Some of the crime is up, especially thefts, but robberies and burglaries are down, which is a good thing. We receive, I would say, I think it's weekly reports from our crime analysts, and overall our calls for service. And I would say our calls for service are down from about 200 a week to about 135 to 145 calls per week. Our greatest number of calls are around disturbances. These are between people, noise, family. Those constitute the greatest number of calls that we're receiving. We're also getting calls around alarms, shelter in place, reported violations, and then medical calls and welfare checks. Those continue to be calls that we receive on a regular basis. Now, in terms of overall Part 1 crimes, and so robberies are down about 18.4%, and that's year to date. And they've been way down the past few weeks. Normally we get anywhere from like eight per week. Now we're getting 2 or 3 per week. It's possibly harder for predators to move around and escape since there's much lighter vehicle traffic and foot traffic. Aggravated assaults, which are also part of Part 1 crimes, are also down about 14.3%. And then our burglaries, this is break-ins to homes or businesses. Those are also down about 24%. And it's been even more prevalent during the shelter in place, about 3 to 5 per week. Theft continues to be our biggest challenge. Thefts are up with the biggest increase in numbers, around 10.4% total. And I'm going to break it down a little bit. So petty theft, that meaning the loss of less than about $950 in merchandise, is up about 7.4%. We've had about 25 incidents. And petty theft, yes, about 25 incidents for petty theft. It still may be something that's underreported. Package theft would also be in this category. So if you're leaving merchandise from Amazon and others in visible spaces, please make sure you arrange to have those, be ready for those deliveries when they come. Grand theft, meaning that would be a loss of over $950. That's up about 56.4%. We've had 57 incidents total. This is probably more attributable to the catalytic converter theft, and I know a lot of folks are hearing about that. Priuses are prime targets, and we have a huge number of Priuses in Berkeley. So I want to just encourage folks to make sure that they do not leave things open in their cars so that people are more attracted to them. But catalytic converter theft is what's on the rise for the Priuses. Auto burglaries are down about 4%, though that may be something that's underreported because people generally just deal with it. Auto theft is up 27.1%. We've had about 36 incidents total. And our analyst feels that people are stealing older cars for temporary transportation. And we believe that's because of thefts that we're seeing at about a 2.2% increase. So one other thing I want to point out is that the California Judicial Council reduced bail for all but the most serious violent felonies. So we're seeing people arrested, and when we have to cite them, meaning they get a ticket, for many crimes, the Regional and State Chiefs Association and the DA's offices are registering their concerns because people are engaged in serious and dangerous activity, but they end up not being held. This is not a decision by our local electeds or the DA's office or BPD, but the judges who control the bail schedule. So I just wanted to share those crime stats. I do have other details if we need to drill down further, but thank you for the opportunity to speak on those topics.
Okay, thank you very much. I now want to turn it over to our planning director, Timothy Burroughs, to update us on your department's work in implementing the new shelter-in-place order, which is now allowing all construction. Prior to that, I know construction was limited to certain limited types of projects, supportable housing projects, sort of healthcare, but now all construction is allowed in the city of Berkeley. So, Mr. Burroughs, thank you for joining us.
Thank you, Mr. Mayor. I really appreciate the invitation to participate today, and I really appreciate all your leadership and holding these town halls so frequently, and just your leadership day to day. I know you've been working very hard. And also Dee and Dr. Hernandez, good to be with you. Thank you also for your leadership and partnership. It's been one of the silver linings of this really challenging time is getting to work with such amazing people at the city. And it's been really rewarding to see so many staff mobilize. I want to also want to take a second to thank community members, because under the former shelter-in-place order that well, the new shelter-in-place order goes into effect around at 11:59 tonight. So under the shelter-in-place order that is being replaced, most construction projects, the vast majority of construction throughout the city was directed to cease. And that's small projects, home renovations, to large mixed-use multifamily projects in the core areas of our city. And I just want to acknowledge how disruptive that is, to have to start a construction project and get moving, and all it takes to get a project moving and getting your financing together and your permits. And then to have to pause at some point in the middle of that project is extremely disruptive in many, many ways. And I just want to acknowledge that and appreciate how difficult that has been for many of our community members, and also just appreciate how much people complied throughout the city. Small renovation projects, large projects, ceased construction when we reach out to them. And a big role of my department over the past several weeks has been to direct projects to stop for the duration of the current shelter-in-place order. So now that's changing, right? Now we're pivoting to a new phase of the shelter-in-place order, in which all construction is allowed to resume. And so myself and my staff and my team, we're pivoting to now enabling construction to continue. But there's a couple of important things to keep in mind about the new shelter-in-place order. And probably the most important in the context of construction is that while it does allow construction projects to resume, there are significant new on-site requirements for these projects of all sizes that are designed to keep workers safe and our broader community safe. And these requirements absolutely must be followed. So for small construction projects, for example, so for a residential project under 10 units of housing is how the small construction project is defined in the new order. The requirements include designated a COVID-19 site supervisor to enforce safety protocols, and establishing and posting daily safety screening protocol that all workers, whether you're 1, 2, 3 workers or 10 or 20, they all must follow the safety protocols on the site. You know, we know that COVID-19 is something that many community members have without even knowing it. So even without symptoms, people can be spreading the virus. So it's really, really important that these safety protocols are followed, so that we can continue to flatten and ultimately turn the curve downwards. For large construction sites, the requirements include preparing and posting a new or updated site-specific health and safety plan to address the COVID-19 issue. Also assigning a safety compliance officer on site, and a third-party job site safety accountability supervisor who meets certain training requirements and certification requirements. So there are specific requirements for small sites and for large sites. And for all sites, there's a consistent set of requirements related to maintaining social distancing at all time on the sites, wearing face coverings, providing personal protective equipment specifically for use in construction, hand washing stations, and other requirements that are in the order. And as I said, it's essential that these directions are followed. And our building inspectors are going to be checking, you know, as we continue to do, as we resume inspections now. Many of them will still be remote inspections by video, by phone. Some as needed will be on site. but our inspectors are going to check that safety protocols are being followed prior to proceeding with an inspection at a given site. And as our city manager Dee mentioned in her initial comments, the city is also will be mobilizing a set of monitors that will be out in the community monitoring construction sites and other activities to ensure that safety protocols are being followed. And we in planning are coordinating really closely with our police department. So when we do get complaints, and there will be complaints, I know we will get calls from concerned community members about an activity at a given site, and we want to be able to respond to those quickly. So we're coordinating with our police department so we have a coordinated response when we hear concerns. In the meantime, as construction resumes, I also just wanted to make sure people know that our building permit services, our land use permit services are available online. I'm really proud of the fact that we were able to take a set of services that really mostly had to be done in person prior to the shelter-in-place order. And in a matter of days, we turned an in-person operation into an online telework operation. So if you want to apply for a building permit, receive comments on your plans, we're issuing building permits. You can also apply for land use permits. We're also issuing administrative use permits and zoning certificates. We're mobilizing to resume commission meetings like the Zoning Adjustments Board, the Design Review Committee, and the Landmarks Preservation Commission, so that we can also issue use permits moving forward. And so we're trying to minimize the disruption on housing. We're in an acute housing crisis that's only been exacerbated by the pandemic that we're in. So it's important for us to mobilize and continue to offer our services to the community. And the last thing I say before I turn it over to you, Mr. Mayor, to answer any questions that you or others have, is I also just want to appreciate for a second the staff in the planning department, many of whom have worked as disaster service workers during this period, doing work that is unrelated to their day job, working to help set up the testing site in West Berkeley, for example, or working in the EOC. And in the meantime, also helping to stand up our services, our permit services for the community. I just want to appreciate how quickly the staff were able to mobilize and how dedicated and amazing the work is that they've done.
Okay, thank you very much, Mr. Burroughs. So with that, we're going to turn to questions. And the first set of questions I want to address are really sort of operational enforcement issues. And so I'm going to direct these to the city manager. So the first question is, what is happening with our city camps? Will they be open this year? And I think you're, okay.
Thank you, Mr. Mayor. So we've been working with the health officer to basically determine how we can run our summer programming, given the current order. This is the big issue is the limit of 12 people, 12 youth per site. We've met several times and we'll be meeting again next week to do so, but our plan is to release our summer programming information on May 15th. We're attempting to maximize our ability to serve Berkeley youth based on the current restrictions. And usually, so I just want to kind of share that usually our programs alone provide about 800 to 900 all-day camp opportunities. But given the existing restrictions, we will probably be limited to about 250 spots. So that's going to be a huge change. Right now, childcare, recreation, and camps are limited to youth essential workers and others who have been approved to go back to work. So this isn't a blanket thing for the entire community. It is limited to youth, essential workers, and others who have been approved to go back to work. So many private summer camps like Galileo, et cetera, they've already announced that they've canceled their summer programming. I don't know about Cal camps at this time, but we'll stay connected with them. It is on city property. Right now, private or for-profit camps that use our parks are being told that unless there's a dramatic change in restrictions, they will not be allowed to use the facilities. So we still have a little bit of room to go to lift this up, but we plan to release summer programming information on May 15th.
Okay, thank you very much. This next comment is around crime, and I'm just going to read the comment. I know you've addressed the crime statistics in your initial comments. But this individual is concerned about rising crime. Apparently there was a home break-in and car theft next door by somebody who was previously incarcerated but was released. And I guess the question this person has is, how is prisoner release being managed? As you had talked about, statewide, the courts have eliminated bail for certain low-level offenses. And so we have seen the release of a lot of low-level offenders. And that is an issue that cities throughout Alameda County and the state are dealing with. So these next set of questions are around sort of enforcement. The first question is, this person's working out in their front yard and driving to the store for essential items, but they're the only one wearing a face covering. What can be done to educate people and emphasize the need for facial coverings when outside of their own homes? And
so yes, this is a big issue. I think we're moving into new territory on the requirement, right? So before it wasn't a mandated request, that it was just a request that please consider wearing facial covering. But now it is mandated, and it's going to take a little bit of time for folks to get used to that mandate. But I think the one thing that we can do is, if people are comfortable, clearly only if they're comfortable. When you're in settings where people are not wearing masks, it may be nice to have a couple of masks on your person. Give one out and say, I'm not sure if you know that there's actually a mandated that you're required to wear this mask, and if you'd like, I have an additional one. We're going to be doing the same thing through our police department and also through essential service workers that are out there in the field. We'll be handing those out to folks to make sure that they understand this is mandated and required and necessary. And so it's going to be a lot of word of mouth, I think. Well, what mouth with the face covering, but it's going to be a lot of sharing of information. Also, people need to visit our website to find out information about what's important in terms of maintaining your public health and your own personal safety. And then we'll be posting information up all around the city, especially at construction sites and schools as we, and recreation programs as we lift things back up again. I think improved messaging where it's visible to the public on maybe some of our traffic signs about wearing a mask. If there are any agencies out there that have the ability to put up information on billboards, I think it's going to be great to see information that's highly visible to the public that says, hey, you have to wear a mask and this is why it's important. And again, it's data, it's word of mouth, it's visible signage, and it's being vigilant and modeling the behavior that you want to see.
And similarly, this individual has seen postal workers not wearing masks, and is inquiring whether government employees have to wear masks. Everyone has to wear a facial covering, and so it consists of what you just said. It's getting the information out there as much as possible in the community that people have to wear facial coverings when they are outside or interact with people that are not in their household. And I'm very appreciative of the fact the city is going to be making face coverings available for those people that don't have them. I know that we've been passing out face coverings to people who are homeless, who don't have access to them as well.
Correct.
And this is a different question around enforcement. When will the city start enforcing sidewalk parking violations? We need our pedestrian spaces to be clear. They've been taken over by sidewalk parkers and excessive vegetation. If somebody is illegally parking on the sidewalk, they should report that to 311 or to the police department. Which department?
If I think they should report that to non-emergency and also to 311, either or, reporting those types of concerns. And it may take a little bit of time. So I know people are very frustrated right now because we're deploying resources to address the pandemic. So things seem a little longer to get relief, but they should report to 311, or if they have readily available non-emergency number, you can use either. I do believe that vegetation, a lot of landscape was closed off, and now with the new order, landscape and gardeners are available to resume activities and work. So we'll probably see a lot of our community members and neighbors maintaining their vegetation in front of their homes, as well as our city staff. We've already been working on essential services and removing those hazards that could be of concern to community. So I'm glad that that's going to be resumed. So it may take that may address the vegetation issues, but probably not completely. So please, if you have concerns about people parking on sidewalks, we want you to call.
And then this constituent had a very specific case that we will follow up on, where they were ordered by the Parks Department to cut some overgrown vegetation, and so they have a huge pile of debris that they need to get rid of, and they were asking for the city's assistance to help pick up that debris. And so we'll follow up on that specific case. Question on whether people can get smog checks done. We'll follow up on that to see whether smog checks are included, but the shelter in place order does define auto repair as essential business, and social distancing protocols are also in place for those business operations. And then the last question, Madam City Manager, is a recurring question around closing of streets, similar to what San Francisco on a limited basis and Oakland has done on a much larger basis. The question is, who makes the decision to close streets? Does the city have the capacity? What should the expectations of the community be around this? What would be needed to make this happen?
So that is a question that we are getting a lot of inquiries about. I've been working with the transportation manager in our public works department, and he and his team have been researching, looking at our capacity, working on simple plans that we may possibly be able to address. They won't just be on bicycle boulevards, more than likely. I don't have a timeline on when we can implement. Again, most of our staff have been deployed into other areas to respond to the pandemic. One of the issues that we think this could support, but also could be problematic, is the number of people that will come out and start gathering, large gatherings on these public right-of-ways. Now, at this point, we do think that it would allow for more people to be out and have the ability to social distance. So I think that's probably the more than likely thing that will happen, that people will be able to socially distance better. So we're working on it. Don't have a time frame. I'm limited in terms of capacity and staff, but we have not decided a no on implementing a program like this. Again, we've seen success in other jurisdictions. We think it could be successful in Berkeley. And as we reported last Saturday, Mr. Mayor, that Berkeley's already done this, and we can certainly enhance and increase this as an opportunity, but we were the first to step out and do this type of setting for our community and closing off streets so that there's more access for people and families to enjoy their neighborhoods. So we're going to keep looking at this issue. I can't give any definite in terms of an actual date. It may involve mobilizing community members to help with the volunteer effort, but that is something that our health officer, our transportation engineer, and myself will need to look at moving forward. I hope that answers the question. I just don't have a date certain for you.
Thank you. So I'm going to now turn to a set of health-related questions. We got a lot of questions, Dr. Hernandez, about do people need to wear masks when they're outside? And do essential workers have to wear masks? So why don't we start with that? And my understanding is that if you are outdoors, and you should only be outdoors for very specific limited circumstances, traveling to and working at an essential business, you are allowed to go outside to exercise, to ride a bicycle, to go to a grocery store, or you have other essential trips that you need to take. But my understanding is that if you do go outside with somebody in your household, you are not required to wear a mask, but if you are outside or you are an essential worker, that you must wear a mask. So can you clarify the circumstances in which people have to wear a mask?
Sure. I think the easiest thing to say is always have a facial covering with you when you go out. If you're hiking or if you're out in an area that is a little more open and there are no other individuals with you that are outside of your family, it's okay not to be wearing a face covering. However, you should have it because you never know who you're going to encounter. And if that's going to be in an area where you're not going to be able to maintain that 6 feet of space between you and that other individual. So I would say wear it, have it with you. You don't have to wear it all the time if you're able to maintain that social distancing. And this is for outdoors. For essential workers, that's the same rule. If you're able to maintain that 6 feet distance and you're outdoors, that's okay. But you should always have that face covering. When you're indoors, different story. You have to wear it. If you're outside with other people outside of your household. If you're in the grocery store, you should have it. You're online, you should have it. If you're in line outside, you will be required to wear it. Say you're online waiting to get into a grocery store or another business that is now able to operate. So that's what I would say. That's the short answer is that wearing it's better to wear it than not wear it if you're not sure. But those are the instances where you would be wearing it.
Thank you very much. So this resident had a request for more general information on cases in Berkeley. Can you say anything about whether the cases are related, symptomatic or not, hospitalizations, any particular populations most specifically impacted? And I know that under HIPAA that we are restricted in sharing information publicly as to who has contracted COVID-19, where they live, or any very specific details about those individual cases. But we, as you had noted at the beginning, we have launched a dashboard, which we're building on, to provide more specific data about cases in the city of Berkeley. And so, well, we can't have like specific information about each individual case and where that person lives. Our public health staff are working to try to provide a more specific analysis around cases in the city of Berkeley on our dashboard.
Absolutely. And if there's a need for people to know, we will let them know. And sometimes that would include more of a mass communication. Sometimes it would be with a press release. And we've done that in the past for other illnesses, specifically measles a few years ago when we did have an exposure where we couldn't locate who was exposed. And it was something that was needed to make sure people were aware that they might have been exposed if they were in whatever location at specific time. So we definitely want to assure people that that we will provide that information to make sure that people's health is protected. In terms of data, yes, we're going to have as much data presented as we can when we look at the indicators for how we're looking at opening or relaxing the restrictions or having to pull back on them. The data is available on the dashboard. We're going to put more information up there so people have that available to them.
Thank you very much. These next few cases are very similar around sort of the vector of transmission of recent cases. And this resident asks, why is the curve only flat and not zero? What is the suspected vector of transmission of recent positive cases? And this other resident asks, how can public health find out where infection remains? And I know that we do contact tracing, well, with any disease, but particularly we've done with COVID-19, every individual case we're doing contact tracing. And so I think the data does show that the shelter in place order has been successful in stopping exponential spread in our community and increasing the capacity for testing, you are going to see an increase in the number of positive cases. But if there's anything else you'd like to add, Dr. Hernandez.
Sure. Thank you for mentioning about the shelter-in-place order helping to curb the spread. And it also has reduced the impact of deaths on our community. The modeling had projected that for the Bay Area, we would have 20 to 30,000 deaths during this time, and we've had under 300 deaths. So that's a big, big change. And that is due to compliance to these orders. In terms of vector, it remains to be person to person, and the trickiness about the transmission is that it can be transmitted when someone's not showing symptoms. So we are hoping to expand testing to everyone, but at this point we're expanding it to anyone who is symptomatic, and we're hoping to catch more cases because of the ability to have more testing available. And we will see number of cases increase. And that's why we need to expand the public health workforce to do that contact tracing. So when we get those cases, we're able to isolate them right away. What we're hoping is that the rate of hospitalization stay flat, and that is something that you can see on Alameda County webpage on their dashboard. For the city, we're flat in terms of our hospitalizations for a number of weeks, which is great. And we're hoping that even though the numbers may climb in the cases, that the hospitalization stays flat and that we don't have any more deaths. So that may happen. We want to make sure that those numbers are controlled as much as possible. So we are looking at specific populations that are higher risk due to the fact that they're in group settings. And that's what I mentioned in terms of trying to do more testing at skilled nursing facilities or in other congregate group setting facilities.
And just sort of following up on testing, I know one thing that you had added in your initial comments was that we are going to make available testing for symptomatic people in the Berkeley community. And so, we've been sort of incrementally expanding testing capacity, and that is something that the city will be similar to what some other cities have done, including the city of Oakland.
Absolutely. And if we can get more test sites, we will. We're aggressively looking at expanding not only to the site that we have, but into other opportunities that we're exploring.
Could you touch a little bit about specifically making testing available for essential workers, grocery store workers, and other essential workers that are in direct contact with the public?
Sure. If individuals are insured, they can go to their healthcare provider. If not, they can also come to that test site that we have in the city. And there's a triage line. Oh, I forgot to get you that number. I will get that number. Let's see if I could do two things at once. Well, actually, let me finish my sentence and then I'll try to find it for you, and then I'll get back to you. So we do have a triage line that is set up and operates from 9 to 4 p.m. every day. Definitely starting Monday, we will be taking appointments to schedule test visits at the site in Berkeley, which is down on 6th Street. So anyone can go. It doesn't matter whether you're insured or uninsured. It's a free test. It costs you time to get there and to take the test. And it's for anyone who is a resident of Berkeley or who works in Berkeley. So if you work in Berkeley but live in another city or county, we don't mind. We want to get those essential workers that are here in our city tested. If you're a grocery store worker or if you're a healthcare provider, does not matter.
Thank you. This next set of questions is around, are there any confirmed cases in nursing homes or long-term care facilities? is testing being done at those particular residential care facilities? Sort of what is the city doing around outreaching to and testing and providing care for people that live in senior homes, nursing homes, residential care facilities?
We don't have any cases in residential skilled nursing facilities at this point, though I'm unfortunately preparing for one, unfortunately. So 2 weeks ago, I wrapped up my visits that I did in conjunction with Fire EMS to the facilities where I worked, where we met with this facility staff, administrative staff, to understand the facility a bit more, to do a tour to understand the setup of the facilities and talk about testing. They're doing testing for anyone who's symptomatic. That's happening. That's standard, and they do that for flu. They're doing it for COVID-19. What we're starting to do and hoping to do it for all the facilities is doing what we're calling surveillance testing, which is testing anyone in the facility, no matter whether they're symptomatic or not. And that includes residents and staff. And that's to pick up anyone who's positive so we can isolate that person to make sure that there's not additional spread. That's something that we're piloting this coming week, and we're hoping to do that at every facility. San Francisco has actually ordered facilities to test every 2 weeks. We're not there yet. We're hoping to see how we can roll this out with our facilities so that we continue to protect the residents and the people that work in those types of facilities.
Thank you very much. I'm going to take a few more questions, and whatever questions we don't get to today, we will be sure to address next week. But this question is around groups of children being able to play together, and can children play together if two families pick their own quarantine pods? Example, if they select only one other family to interact with solely.
Not yet. The change in the order allows children of essential workers and those that are allowed to go back to work to be able to take advantage of having childcare and summer camp activities in established facilities. So these are camps that, for example, are organized by our city or in other established type of programs or daycare type programs that are already established. We consider those folks pods. So those children in the group of 12 or 10, depending on whatever is more, the restrictions are more strict. That would be considered a pod. So that idea of a pod is actually what we were applying in this same in our order, that this group of 12 would be a pod for a month, because we're thinking of stable time as being the camps should not be weekly camps. So they're not camps that would be 1 week and then you can go to another camp. Would not be considered stable. We're looking at a month's time as a stable amount of time with that stable group of kids. So we're not ready to expand it to families interacting with each other in these pods, but that concept is exactly what we used when we were expanding it for those that were able to go back to work. Hopefully we can expand it to allowing families to interact in that way. And we're going to be looking at how this expansion has impacted disease. One of the things about children is that what we are seeing more and more is that kids are not getting disease from each other. They're not giving disease to adults. It's more likely that adults are giving it to children. And that's what we're seeing right now with the data. We're watching the data every day. We're learning more from studies that are being released. But at this point, that piece of information from those studies, as well as trying to see how this pod concept applies to essential workers is really going to help us understand the impact of this disease as we move forward.
And then my last question, Dr. Hernandez, is are we considering testing asymptomatic people?
Yes, at this point, as mentioned, we're doing it with the high-risk populations. We've done some of that for those that are being placed in hotels that are experiencing homelessness, and then also in other group settings such as the long-term care facility setting. We're hoping to do it to expand it more. I know other jurisdictions have done that. We're taking a stepwise approach, and at this time we're doing all symptomatic individuals, and I believe healthcare providers are also doing the same thing, that they're testing right now just symptomatic, but we're hoping to expand that even more broadly in the next coming weeks.
Thank you so much, Dr. Hernandez. Mr. Burroughs, there are a few questions relating to the permitting process and construction I'd like to go to at this time. So I guess the first question, I think I can answer it. It says, with construction rules being relaxed, are all construction permits, considered an essential activity? And because construction is being allowed, it is an essential business activity that is permitted under the order, if I'm not mistaken.
That's correct. Yes, that's correct. All construction is allowed to resume at this time.
And then with some city employees being reassigned to address COVID-19, how has this impacted the planning department? Will this impact the amount of time it takes for people to get permits processed or inspections scheduled?
Well, I appreciate that question, because it's true. We have, as I mentioned, several staff that were mobilized as part of the EOC. And so we're taking that into account. That being said, we have been able to, in addition to supporting the work of the EOC, we have been able to stand up our building permit and land use permitting services. So for any building permit, our permit service center staff are working remotely, our plan check staff are working remotely, our inspectors are mobilized. Those building permit applications are moving just like they were before the order was issued. So there should be no delay in getting comments on your building permit application or receiving a building permit. Similarly, on the land use side, we are actively issuing zoning certificates and administrative use permits. Our staff are all working remotely, but reviewing applications and coordinating directly with applicants and issuing zoning certificates and administrative use permits for projects throughout the city. Use permits are projects that need to be reviewed and approved by the Zoning Adjustments Board. And as you know, all commissions have been on pause since March, where the city manager directed that boards and commissions not hold meetings for 60 days, starting, I believe it was on March 13th. And so there is I would say, a backlog of use permit applications that are waiting to be reviewed and approved by the Design Review Committee or the Zoning Adjustments Board. The good news is that we're now preparing to resume those commission meetings. The city manager, as the director of emergency services, has authorized that we resume commission meetings held remotely, held online. So we expect that our commission meetings, similar to how city council is functioning now, and some of the city council policy committees are held online via Zoom. We will resume commission meetings, quasi-judicial commission meetings like the ZAB, the Design Review Committee, the Landmarks Preservation Commission, the Planning Commission. We will resume those meetings very soon. I can provide more specificity on timeline next week. We're going to put some information out on timeline next week with specific dates. But I do want folks to know that we're in the process of planning those meetings now, which will enable ZAB to continue to review and consider use permit applications, and then we can issue those use permit applications once ZAB approves.
Thank you. There are a few questions around contractors having to comply with the required social distancing guidelines, and could you maybe touch a little bit upon, there are guidelines that were put in place for various types of projects and how those will be enforced?
Absolutely. So as I mentioned earlier, construction can resume, but it must follow very specific project safety protocols that were included in the shelter-in-place order. So there's two appendices attached to the shelter-in-place order that you can see on the city's website. One appendix is small construction project safety protocol, and another is for large projects, large construction projects. And there's specific measures that each one of those projects must take in order to operate safely at the site. And we are going to be very proactive as a city, not just the planning department, as a city, in ensuring that those safety guidelines are followed. And the first step we're taking is just to be very proactive about our communication. So every site, active construction site in the city of Berkeley, will receive a communication directly from the planning department that provides information on what the safety protocols are. We're doing email blasts throughout the city to anyone involved in a construction project. You'll see a news release on the city's website early next week that provides guidance on safety protocols at job sites. And our building inspectors are sort of the front lines of construction site work for my department. And when they make contact with the site in order to initiate a building inspection, they'll first be checking in that the guidelines and the protocols included in the shelter-in-place order are in place. And if it's clear that a site is not following those protocols, then that building inspection will not resume. And I know that our team in the fire department that also does inspections has a similar approach. There's a non-emergency police phone number, which is 510-981-5900. That's the number that community members can use if they have concerns about a construction site that is not following those safety protocols. Then that's the place to report those concerns. And my department and the police department will coordinate on a response. And then finally, as our city manager mentioned, we're mobilizing a set of monitors in the city that will monitor construction sites and other types of essential businesses to ensure that safety protocols are followed. And if they're not, those monitors will report that information into our non-emergency line, and we'll respond as needed. So we're being very proactive, and we're taking enforcement very seriously.
Thank you very much. These last questions were around sort of resilience. And one question is the city considering what would happen if we were in a health crisis and we're also impacted by another type of emergency? Certainly that's on all of our minds, and deeply concerned about a fire event or earthquake or other natural disaster occurring, which would put our community even more at risk. But one thing I will say that how we have responded as a city organization to this emergency, I think has made us even more prepared to respond to other emergencies that may occur in our community. And we still need to ensure that we have resources and are prepared for things like fire events and earthquakes. So I know that this is something our fire department is continuing to address, even while we are focused on this public health response. So that certainly is a concern and something that we will respond to if needed. But how we've activated the Emergency Operations Center and organized all of our city departments to respond to this emergency, I think shows that we have the capacity to address multiple emergencies.
Yeah, no, I think that's absolutely right. You know, our Emergency Operations Center is now already operating. And so we have staff throughout the city who are using that muscle, right? We are gaining a lot of experience about how to operate effectively and efficiently in an emergency response situation. And so if there were another disaster like a fire or earthquake right now, we already are mobilized to respond to disasters. And we're prepared to activate additional staff as needed throughout the city. I also want to emphasize that there's a lot of steps that community members can take. Certainly the city and our staff are going to be ready to respond no matter what the disaster is. But it's important that community members take steps today, if they haven't already, to be prepared for a disaster. So creating a disaster preparedness plan with your family is a really important step. Stocking your supply kit, 5 days worth of food and water, the medicines you need, the first aid kit, a change of clothes, flashlights, batteries, things like that in your readiness kit. Sign up on the city's website for AC Alert, which is our emergency notification system. So you get information quickly from the city and other agencies in the event of a disaster. Look at the city's website, cityofberkeley.info/ready. Has a lot of guidance on how you can prepare your household for a disaster. So there's a lot of steps that individual community members can and should take right away. And in the meantime, we as a city are going to be prepared to mobilize and respond.
And Madam City Manager, anything you want to add on this as well?
Yeah.
I think
Am I muted?
we can hear you. No, you.
One thing I did want to add is 4 years ago, and maybe even 5 years ago when I joined the city, one of my most important tasks was to elevate our emergency operations center and the structure of that center. And so I've taken it very seriously in terms of my role as a city manager and making sure that our organization is prepared. With that in mind, we create multiple scenarios in those emergency center operations in terms of training of our staff so that they are ready to mobilize. And one of the things that we do that I think is really impressive is that we throw in multiple issues. So we look at an earthquake is happening, a massive fire is happening, and a bridge has broken down. So, and then we look at how do you respond when all of those three major disasters are occurring in your city. So our staff they're poised, they're ready, we practiced, and I think the challenge before us now is making sure our community is ready. And so that's where we are. And I want to thank Timothy for his comments around the EOC and the work that team is doing. And we've also trained our council. We've had at least a couple of meetings with council to talk about how we continue making sure that policy needs are addressed through local emergencies. And we've seen how that has worked. So, because we know we'll need a continuity of government in terms of policy decisions. So I appreciate the council and the mayor and all of your work and support around emergency operations for the city. Thank you.
Thank you. This question is, what is the city doing to ensure that we retain critical medical services such as Alta Bates Hospital? The crisis has shown how critical these facilities are for the health of our community. I completely agree. As many people know, in 2015, Sutter Health announced that they were planning on closing Alta Bates Hospital in the city of Berkeley. And we are continuing to work to keep our emergency room and acute care hospital open. While Sutter is focusing on their response to this pandemic, and so is the city of Berkeley, we will continue to fight to keep our hospital open. And we encourage the Berkeley community to please contact Sutter Health to express your concern about the need to keep an acute care hospital in the city of Berkeley. I'm just going to touch a little bit on a couple of questions that were directed to me and then wrap up. This was a comment, please distinguish between mandated requirement for physically distance and social distancing increases isolation. Please encourage residents to maintain relationships using an array of technology to which they have available: phone, email, Skype, FaceTime, social media. Excellent idea. We know that sheltering in place takes a toll on everyone's mental health. And so we strongly encourage you to take time to reach out to a friend or family member via phone or via video chat. Maintaining those social connections while social distancing is extremely important. This resident's concerned about the upcoming election and the ability to vote by mail, not just here, throughout the country. I know we touched upon this, I think it was in last week's town hall, and we are monitoring discussions on the federal and state level around how elections will be conducted. And we will be conducting the presidential election, and we'll inform the community about any changes that we are informed by the state government. 70% of the city votes permanent absentee, so we do see a large number of people that already vote absentee, and there may be an increased number of people that vote absentee this election. But we are moving ahead with the election, and we are going to do everything we can to make sure that it is conducted in accordance with state and federal regulations, and also protecting people's voting rights. We received a number of questions also on Facebook, and we are going to get to those questions next week. But before I close, I want to repeat several times the triage line that Dr. Hernandez touched upon in her comments. That triage line number is 510-981-5380. 510-981-5380. 981-5380. So if you are symptomatic, you would like to get tested, please call that number, 510-981-5380, and we will certainly be getting that out in the Berkeley community, and that will help you access the testing that the city has available. So with that, I'd like to just thank our city leaders for joining us today, our city manager, our public health officer, our planning director, but also to thank them for the incredible service that they have provided the Berkeley community at this time. They have been working around the clock and have really just given an enormous amount of time and self-sacrifice to make sure that our community is supported and to keep our community safe. So thank you for all that you've done. Thank you for your service to our city, and thank you, the Berkeley community, for participating. If we did not get to your questions this week, we will get to them next week. And with that, please be safe. Please enjoy this beautiful weather this weekend safely, practicing physical distancing, and please wear a face covering. Bring your face covering when you're outside. And thanks for doing what you can to help flatten the curve. And please continue to stay at home to save lives, to practice physical distancing of at least 6 feet, and to remember to wear a face covering when you're outside. So with that, we'll see you next Saturday, and thank you, Berkeley.